Is your mom with you today?
I would say
One of the things our team noticed years ago was there was a gap in our community when it comes to treatment opportunities for our children that are struggling with obesity. Our team in community health is heavily involved in the programs and initiatives to positively impact our obesity rates. Fit Kids is one of those programs that has been adopted by Parkview to positively impact our obesity rates in Northeast Indiana.
There is such value in programs that focus on the preventative measures because that means the kiddos can live a life without chronic illness. If they have the knowledge to create behavior change in the way that they nourish their bodies, we can prevent chronic illness such as obesity, which then leads to type 2 diabetes, that leads to hypertension and heart disease. All of my patients all over, everyone's facing some sort of barrier.
For a treatment program for these kids, they would have to travel at least 100 miles, and that is not accessible for a lot of our families.
A lot of our chronic illnesses can be prevented with nutrition interventions, but not everyone has the same access.
We see a lot of children, unfortunately, bullied because of their size. They can be affected mentally because of that and struggle with their mental health. And then it can lead into other areas such as their nutrition and what are they putting in their body or what they're not putting in their body. Being a parent myself and sitting in a doctor's office and let's say I hear my child is overweight, it's really hard to hear as a mom. It's so easy to take on that as this is my fault, I did this. But because there's such a negative connotation with the word or the phrasing, that it's just difficult for most people to have any sort of conversation around it.
Six home-cooked meals a week.
Let's do it. Six.
Home-cooked meals a week.
Really, the mission of Fit Kids is to help support a healthy lifestyle for families. They're here because they want to make positive changes that are lasting for their families. We started very small, working with a few providers at Parkview, have grown significantly. Any provider within Parkview can refer, but now we're working with external partners as well. Families can self-refer, schools can refer. So it does fit into Parkview, but it also fits into our larger community as well.
There is a written curriculum that everything is based off of. So each week we have different nutrition topics that we cover.
Within the program, we talk about three main areas. We'll have a little bit of time focused on nutrition, then some time on movement and fitness, as well as a behavioral health component.
As you've noticed, there's things all over the floor. It is a giant game of life.
All of our food relationships are really unique. It comes from, experiences as kids. So it's my job to figure out what their food relationship is and see if we can make it a positive one.
Breakfast first.
We are helping them so that they don't have to go in and see the doctor as frequently, that they're not on as many medications. So to bring it all together and provide all of this information and this education to make them more well-rounded when it comes to a healthier lifestyle.
I don't want to provide something that they can do for a week because realistically, we eat every single day for the rest of our lives. So I want them to know that this is my knowledge I want to share with you so you can live your healthiest life.
As we work with kids younger and younger, we're able to hit them at a point that gives us a chance to prevent some of these chronic diseases from happening later in their life.
These kids can determine what our obesity rates look like in the next 5 to the next 10 to the next 20 years. How can we figure out a way to prevent chronic illness through nutrition? I'm not a mom, but hearing some of the parents' struggles, it's incredible what they're able to accomplish. So they've also taught me a lot of lessons. You know, maybe I've made an impact on them, but I think they've made a great impact on me as well.
As someone who struggled with her weight as a child, it's hard to put into words the impact that this has had on me, but it helps me wake up in the morning and keep doing it no matter what.